Hey, what's going on, everyone? It is Sunday morning. It's the day after Impact 6 Impact event here in Meridian, Idaho at our clinic. We had a bunch of doctors fly out from around the country. We had a handful of instructors fly in. Some people I've worked with for months, even over a year, that I've never met in person, was able to meet in person. That was awesome. And I wanted to give a recap of what we covered, and I want to talk about my goals for all of the attendees and really all the members of Move Now University and all the people out there that have followed our stuff, that have not yet joined our program, and just give you an idea of what we are creating, the goal of what we want to create. Conversation I just had with one of the doctors that drove in from the other side of our state, and anyway, just had some good insight I wanted to share. So first off, the overview of what we did this weekend at Impact. We started on Friday and we started off with clinical. So we did lots of clinical stuff. What do? We talked about some rules of functional movement, the big picture of how this all fits together into a chiropractic practice. Because at the end of the day, we're not just exercise therapists. We're not just replacing what physical therapy does or a personal trainer does. What we're doing is creating a whole package for a patient to really reach true health. Because something that this other doctor I was just talking with was talking about, he's upper cervical doctor. He was sharing some really cool breakthroughs that's going on in the upper cervical world. He said, look, truth is truth, right? If someone wants to have the full expression of health in their body, there's things that have to be addressed. And obviously it starts with spine as chiropractors, making sure that the spine is healthy, nervous system's functioning as well as possible. But then it goes, segment, posture, movement. You have to address all three of those things. And something that we talked about in the talk that I think struck a chord with Dr. Jeff Kronk from Smart Injury Doctors, who flew out to meet in person and also speak at the event. Dr. Kronk was sitting in the back of the room. He was listening to me talking, and I talked about something that I guess just clicked with him, and it's something I talk about quite often, but it was the first time he heard it in this way, and he was like, oh my gosh, that just makes so much sense, and that makes it so much easier to explain how this all ties together. But essentially it was, I made the comparison. I said, look, drug companies market for medical doctors. Medical doctors get big pharma marketing for them. Patients already go into the doctor. They already know what kind of pill they want. They are already sold on this concept that they want some kind of drug to make them feel better. Unfortunately, that's not the truth, and that's not what's best for the public, but that's what they've been indoctrinated to learn. So that's a negative example of how this plays out, but it's an example nonetheless of how effective this has been for an entire industry. Then we have chiropractic. We have what we do. We don't have anyone marketing for us, right? I know you've all heard this before. There's really no one out there going to bat for us. But what is the closest segue of what we do as a chiropractor working on the individual segments of the spine? What is the closest segue? And that segue is the exercise industry, the fitness industry, exercise in general. People know it, whether they do it or not. People know that you should exercise. People know that exercise is a crucial portion of achieving and maintaining overall health. They know this, okay? It's well known. There's gyms, there's, CrossFit is a big thing that I talk about often because it does such a great job at creating a culture. So whether they do it or not, people inherently know they should be exercising. That's movement. So movement is already marketed for us. So start with movement. And this is what I talked about this weekend. Start with movement, work yourself backwards to segment. How do you do that? Movement. Movement is crucial for overall health. As you progress in age, you watch people around you struggle with movement, get stricken with sickness and disease, and die a horrible death. Why can't they move well? That's the question. Now you have to bird's eye view, zoom out, and analyze what's going on. Well, they can't move well typically because either there's a postural, segmental, or both type of issue. So how we talk about it is we go movement. Movement is first. That's where you find that common ground with people that already understand that movement and exercise is important. You break down movement to them. You explain how postural distortions, abnormal posture, affect movement and destroy proper movement patterns. And then abnormal movement is what gets you into these traumas and injuries over and over again and prevents you from actually healing if you don't attain and maintain functional movement throughout your entire body, your spine, your extremities, everything. And then, so you have movement, you have posture, and then you have this segmental thing. What's the segment? The segment is the trauma. The trauma occurs to the segment. The joint's deranged. Call it a subluxation, call it a somatic dysfunction, whatever you want to call it. A joint gets deranged. It affects function of a nerve or the nervous system as a whole, and it screws stuff up. So segment, posture, movement, posture, segment. The way you explain it to the public and get yourself in front of people is you start with movement and you work your way backwards. I went through that. I remember Dr. Kronk was taking notes in the back. He came up after me and just said, man, that clicked for me. I know you've probably said it before, but that clicked for me. And then we had some great conversation after it. So back to what we covered this weekend. Friday we went through the science and breaking it down in simple terms. The top 10 dysfunctions that you'll typically see in your patient population. So we talk about things like how shoulder dysfunction works with scapula and how it relates to the glenohumeral joint, how thoracic mobility comes before shoulder mobility. We talk about how it's important to clear the neck patterns first before you really dive deep into other patterns, because every other pattern has pieces or involves neck movement and neck functionality to properly perform these other patterns. So you want to clear the neck first. Granted, right now I'm kind of mixing in rules of functional movement, rules of exercise, and these top 10 dysfunctions. Other dysfunctions we talked about is like overactive synergist of piriformis muscle and how that relates into typically a adaptively shortened tight hip flexor in the front, which then reciprocally inhibits the musculature on the opposite side of the joint action, which is hip extension, which is primarily going to be glute max, glute med. So those get reciprocally inhibited. So now overactive synergists, other muscles like piriformis and deep hip stabilizing muscles, are the ones that now attempt to do hip extension or hip abduction, external rotation instead of extension. So now you have this dysfunctional gait, or every time you walk, because you can't extend your hip back, your pelvis flexes and it wears out your lumbosacral joint. So i.e. chronic low back reoccurring pain because your patient lacks hip extension. Why do they lack hip extension? Because they're not functional in their movement patterns. And so anyway, it's this whole cascade. That's what we did. We talked about the top 10 dysfunctions. We talked about rules. Then we went into the movement assessment. We went into what we do on day 2 with our patients. We go through a functional movement assessment. We drilled through that. We had someone up front as a patient. We went through and we just group talked about what we saw, and we really broke it down, tied it back into the clinical end, went through that for a couple of hours, really pulled out some great clinical gems. People were taking notes. It was awesome, answering questions, creating clarification, getting people to imagine how they're going to do this in their clinic, how they're going to start taking this implementation process of Move Now University to the next level in their clinic. So we saw that. That was exciting. Then from there, what we did is we had a patient of ours come in, had some dysfunction, Dr. Ryan Goodman, who does a lot of soft tissue techniques. He's a member of Move Now University. He knows a lot of clinical stuff. He wanted systems in place. That's why he joined our program. That's why a lot of people do. Well, he came out as a guest instructor, going over some more in-depth soft tissue techniques on a sample patient of ours who came in, who had some issues in the hip, and he went through and showed his workup process and different soft tissue techniques that he would implement. He went through and did that. People got a lot out of that. Then we went through and talked more about systems, exercise. Dr. Singyap Rao, who's also a early member of Move Now University, he's the one that introduced me to this product called Protect Spine, which is a functional spinal decompression. They call it floating manipulative therapy. It's pretty awesome. He introduced me to the North American distributors. We got one of those devices in our clinic. We've seen some fantastic results with the acute population, but also people that just have mobility issues, where you can go through different mobility routines in a floating position. So cool technology, I know, just by explaining I'm not doing it justice, but Ro came out, demonstrated various protocols on that machine that he tied back into the Move Now D1 through D8 protocols, which is dysfunction 1 through 8, which is cervical all the way down to squat pattern. So he shared that. That was great. That basically rounded out Friday. Saturday, then we came back in, and Saturday we went through day 1, day 2, day 3, day 4. So we talk about day 1 is new patient consult, exam, x-ray, adjust if acute. So if they're acute, you adjust them. If they're not acute, you don't, because you got stuff to analyze in preparation for day 2. Day 2 is x-ray report of findings and BROF. So we call that the brief report of findings. A lot of moving parts there. And then movement assessment on day 2. Day 3 is now formal report of findings or financial report of findings. Is where we map out their clinical plan. We go through the finances. We get the person to understand the entirety of what this 12-week transformation is going to entail. They commit. They get on board. Day 4 is now the exercise orientation. That's where the patient gets onboarded into the exercise area. They get access to the online membership site that we've created and cloned and set up for all of our doctors called the 12-week transformation. They get their journal that they're going to follow along for those next 12 weeks. And they get an orientation of exercise. And we meet them where they're at. If they're advanced, we go through more. If they're a novice, we don't want to overwhelm them, but we start to welcome them into this process of functional movement, corrective exercise. That's day 4. And then throughout that, we had a couple guest speakers. Dr. Kronk from Smart Injury Doctors talked for a good hour, 15 minutes on spinal ligament injuries, and really just the big picture of not just, this isn't about just personal injury. It's not about car crashes and work comp. This is about achieving the best results with your patients. It's about the truth of the matter and having a well-rounded approach so you can get just predictable results. So Kronk did a great job. Loved having him up there. And then Dr. Perry Barnhill from Fearless Chiropractor, who helps with chiropractic compliance, protects chiropractors, helps them with understanding coding and insurance billing and documentation, all that stuff. He's been working with us for the last couple of years. Great guy, helps our clinic. Like, we are clients of his, but also helps all of our Move Now doctors. He came out, spoke. That was awesome, engaging. And then we rounded it off with all the clinical stuff, stayed after for a good hour, hour and a half after we finished at 6 p.m. yesterday, answered questions, went through technique, and just everyone got to know each other a little better, which was great. Last thing I forgot to mention, which was the very beginning, dear friend of mine, Dr. Fred DiDomenico from Elite Coaching, who I've known since 2012, he did our intro and talked about the difference between lifetime and lifestyle patients, and how to create that, how important the communication process is, and really creating the vision and taking the action steps required to achieve that vision that we want in our practice, in our own lives, in our patients' lives, for our families. So that was basically what we did this weekend. It was awesome, and everyone is amped up and ready to now take those pieces that maybe they needed some in-person clarity to light the fire to them a little further, or refine what they're doing to get systems dialed in a little deeper in their clinic. We had doctors come out, we had staff members of doctors come out, and yeah, again, it just reminded me of why we do this. It's a ton of fun. It's great meeting these doctors. We are building a tight community of doctors that have one thing in common. They want to improve clinical excellence. They understand the importance of exercise and functional movement, and they want tried and tested bulletproof systems to go through this process. So I'm so excited to do our next impact event. We're probably going to shoot for in February. So we had a lot of doctors that I know couldn't come out to this because of all the COVID stuff going on in the country. It was just too challenging for them to travel. So hats off to all the doctors that made the trek and came out here. And also heart goes out to all those doctors that wanted to be here but just couldn't and are struggling with what's going on in their restrictive states. Hopefully in February we'll give enough time and mellow so that all the doctors that wanted to be out here that couldn't can make it out to the February event. If you haven't